Hello friends, I'm Dr. Ram. Today I will discuss some useful first aid skills. First aid skill for seizure or epilepsy. Step 1. Do not restrain the person but use a blanket or clothing to protect his head from injury. Step 2. After the seizure, help the person rest on his side with his head tilted back. Do not put anything in his mouth. First aid skill for heat stroke. Step 1. Move the person into a cool place away from direct sunlight. Step 2. Have the person lie down with feet elevated. Step 3. Remove the person's unnecessary or tight clothing. Step 4. Apply damp cloth or ice packs to armpits, neck and groin. Step 5. Give water and fan him. First aid skills for burns. Step 1. Cool the burn under cold running water for at least 15 minutes. Step 2. Loosely cover the burn with cling film or a clean plastic bag. First aid skills for stroke. Fast test. Step 1. Face drooping. Is there weakness on one side of the face? Step 2. Arm immobilized. Can he raise both of his arms? Step 3. Speech impaired. Can his speech be easily understood? Step 4. Time to call emergency if any of the above happens. First aid skills for SPRAIN. RICE method. Rest. Support the injured part in a comfortable position. Step 2. Ice. Use an ice pack to reduce pain and swelling every 3 hours. Step 3. Compression. Wrap the injured area with elastic bandage. Step 4. Elevation. Keep the injured part elevated to limit swelling and bruising. In case of fracture, Step 1. Stop any bleeding. Do not try to realign the bone. Step 2. Immobilize the injured area. Make a splint. Place it gently under the limb and tie it to the limb with pieces of cloth. Step 3. Apply ice bags to limit swelling and relieve pain. First aid skills for heavy bleeding. Step 1. Elevate the wounded area above the heart. Step 2. Put pressure on the wound. Step 3. If there is foreign object in the wound, then apply pressure around it. First aid skills for heart attack. Step 1. Identify the signs. The person may have persistent voice-like chest pain, which may spread to the arms, neck. Step 2. Call emergency. Step 3. Ensure they are sitting. First aid skills for no breathing. CPR. Step 1. Push hard and fast on the center of the victim's chest. Step 2. Tilt the victim's head back and lift the chin to open the airway. Step 3. Close his nose and give mouth-to-mouth breaths. Step 4. Repeat chest compressions and rescue breaths. First aid skills for choking. Step 1. Get behind the person. Step 2. Give 5 back blows between his shoulder blades. Step 3. Give 5 quick upward and inward abdominal thrusts by holding your hands between his navel and lower rib cage.